And the next question is, why is this generation expected to have a shorter lifespan than their parents?
I think it's quite multifactorial. I think that there are, 25, 30 years ago, people would let their kids walk to school. There were not so much availability to the high-fat or high-sugar drinks and snacks. I guess some good examples used to be when you played after-school sports. If someone brought a bag of sliced oranges, you'd be lucky. And now there's so much reward with foods, and kids go to these sports games, and you come and parents are bringing snacks of crackers and cheese and cookies because as if they're going to starve to death after playing a round of soccer. So I think that there has been a real shift on, rewarding with food versus just letting the kids go out and play. There have been a lot of, the major study we look at for adult heart health is the Framingham study, but there equally have been some studies done for children's heart health, the Bogalusa heart study, which was out of New Orleans, or Louisiana, and the Muscadine study from Iowa that have actually followed kids long term, and there has just been a trend towards increased obesity, hypertension, prediabetes. It's real, and there are young kids that have atherosclerotic disease. They have seen that on autopsy studies. So it is, I think that there's a lot of lifestyle changes that need to be considered, but I think that we've all, there's more availability for people just to drive. Parents are afraid to let their kids walk to and from school. There are more things that kids are encouraged to be sedentary, sitting there in front of computer screens rather than going out and playing in the streets. So I think that there's I don't think you could choose one factor. But
So our next question is, how important is it to get your numbers checked?
It's never too late. I mean, unfortunately, many people don't come to see us until something's happened, ER visit or not feeling well, chest pain, heart attack. So unfortunately, it's frustrating for cardiologists because our tools are so good. You come in, have a heart attack, we fix you up, you go home 3 days later, that it's almost not hard-hitting enough. And so people tend to come see us very late. The second problem is that the insurance companies have no means to incentivize people for prevention. Hopefully that'll be changing. So the key point is getting, the time to do it is when you're actually feeling well. Get your numbers, because even if you feel healthy and you feel like you're on the right path, you could be very surprised by a low good cholesterol or a high triglyceride or a blood sugar that's elevated. So you can't wait for symptoms.
Our next question is, how important is resting heart rate?
We see the lowest heart rates in long-distance bikers and swimmers. I mean, those people tend to have the most efficient hearts. When your heart's the most efficient, it doesn't need to beat as often. It's pumping the same amount of blood as yours is, but it takes less beats to do it. But that really has nothing to do with how, preventing cardiovascular disease and heart health in general. Sure, the better, if your goal is to train and to be competitive in these events, the lower your heart rate is, the better you're going to be for long-distance training. But it doesn't necessarily correlate to cardiovascular events, heart disease, cholesterol, and those sorts of things. So no, you shouldn't be shooting for heart rate in the 40s. That's very unusual. But we do see a correlation between the more fit you are, the slower your heart rate. And I've got many people that come, their doctors say, come see us, because your heart rate's elevated with a resting heart rate, 85, 90, 95, or even 100. And typically those people are, 30 to 60 pounds overweight. They're drinking way too much caffeine, or they're smoking, and it's a combination of factors that drive that heart rate.
Another question, what is the best way to burn fat?
Well, losing weight is a factor of what's going in versus what's coming off, so that's always a factor. You do have to get your heart rate up to a certain level to burn calories. So a slow walk, no matter how far it is, if you're not getting the heart rate up, is not going to burn many calories. So it is felt that you need to have at least moderate intensity exercise, and then the other half is kind of how many calories you're taking in. But it is a moving target. I kind of look at that whole scenario of heart rate and fat burning kind of like eggs. 1 week eggs are good for you, the next week they're deadly poisons, and the science is kind of up and down about where we are with certain things. I don't think there's any definitive word on to burn fat, you have to do this. I think it's just a general approach of burning more calories than you take in, and the science says you should lose weight.
Another question from the audience was, I don't smoke, but What else can I do to maintain a healthy lifestyle? So don't smoke, which is great you're not doing. But as far as diet goes, one of the things that is really important too, and there is a guideline with the Heart Association that says for women you shouldn't have more than 6 teaspoons of sugar a day, and for men it's 9 teaspoons a day. And if you think about it, in an average can of Coke, just the small can, there are 10 added teaspoons of sugar. So I think thinking about drinking sodas, cutting back on that, minimizing, and added sugars in your diet. Avoid added sugars. You know, we tend to want to have the fast processed food. They've often flavored with added sugar and preserved with added salt. So try to bring your own lunch to work. Try to go for the fresh foods. Try to avoid processed meats. And number one, if you drink sodas, really try to cut back on them. Think about your environment. You know, what is it that, you know, if you're at work and you don't have, you know, access to anything, take it with you. So you have some bottles of water there. You'd be able to drink that instead of getting a soda. Take some fruit with you. Just change your world so it makes it easy for you to make the choice that's going to be healthier. And our final question from the audience was, what is your experience with kids' health and sugar?
There's sugar in everything. Right? I mean, there are things that you think are healthy, but the cereals, when the first ingredient is some sugar-based product, you know the calories are coming from the sugar, not from anything more nutritious than that. So I also think there's just such an explosion of fast food restaurants, and I think there has to be just kind of a shift back to recognizing that the processed foods are not the panacea to good health. I mean, it's going back to the fresh fruits and vegetables and the smaller portion sizes and not rewarding kids with food is all going to have to come back to start having people put their children's health forward. You know, the prevention isn't just vaccinations.
That brings us to the end of the video. But to find out more information, please go to the American Heart Association's website at www.heart.org or visit my website, which is www.yourcareplan.org.